Hello everyone. So today I'm going to go ahead and show you the video over a pulpotomy and a pulpectomy setup. Here I have my patient's information. My patient is Tom Lopez. He is 65 years old. He does suffer from high blood pressure. He does take medications, which is lisinopril, which is a very common high blood pressure medication. I do have his chief complaint on here, which is pain to the lower left. He's had it for 3 to 4 days and it's mostly at night. So I've shown my doctor my x-ray and he's decided that we are going to do a pulpotomy on our patient. While I was doing my x-ray, I did use our posterior PA x-ray setup, okay, which consists of your rin, your rod, and your bite tap. So my setup is always going to have, any setup that I do will always have a basic setup and our patient bib. So our basic setup consists of a patient mouth mirror, our Explorer, and our cotton forceps. Along with that, I do have my burrs and my burr block. I have my burrs already attached. On here to the slow speed handpiece, I do have my size 4 round burr, and I do have my 557 burr on the high speed handpiece. Along with that, or accompanying them, I do have my air water syringe tip on my air water syringe. I do have my HVE, which stands for our high volume evacuator, always with the bevel with the hole to the top. I have another air water syringe tip, and I have my LVE, which stands for low volume evacuator. Accompanying all of those, I also do have my 2x2 gauze, I do have my cotton roll, and I have my topical. Remember, using your topical, always ask your patient if they are allergic to any type of food products, because I don't want to give my patient a strawberry flavored if they are allergic to strawberries. I also have my cotton tip applicator here, and I have some extra topical. I have my anesthetic syringe, which on this part, it comes with 4 different parts. My anesthetic syringe itself, my anesthetic carpule, my anesthetic needle, and my sheath protector so that I can recap my needle without poking myself. Along with that, I do have my brooches. And the purpose for our brooches is to remove the pulp inside of the tooth. When you see a brooch, if I can focus in on it a little bit, you are going to see it has all these little spikes coming out of it. And I always refer to it kind of like an upside down Christmas tree. It's going to go in very smoothly, and it's going to bring up the pulp that is inside of the tooth. When you're looking at the pulp that comes out with the brooch, it can either be a nice pretty pulp, and that pretty pulp is going to tell me that that tooth has barely started to get infected. It barely started to go bad. If I get grayish mush, then I know that that tooth has been necrotic for quite a while. A few months that's been already decaying inside of the tooth. And then the last one is I would get something that looks like dust, which is just the particles left over of the pulp itself. It's been dead for quite a long time. I also have doctor's gloves ready for him or her when they're ready. I have my 50/50, which consists of sodium hydrochloride and water with my monojet. Always have it pre-filled so you don't have to fill it when doctor comes in. Along with them, you're going to have the assistant gloves. You're going to have your formal creaso with a cotton ball, a tiny little cotton ball, along with your cotton roll. You're also going to have your IRM powder, your IRM liquid, your IRM scoop, your glass slab, and your mixing spatula. Once we mix the powder and the liquid, our goal is to get a little ball of IRM. It does take some practice for you all to get that nice, pretty ball of IRM. After it's been sitting there for a while, it does become very hard. And that's the goal of it. It's a temporary filling inside of the tooth. The last thing that I'm going to have on my tray is going to be my Woodson. Has a beaver tail end on one side and a condensing end on the opposite side. Condensing end on one side and beaver tail on the opposite side. That is your complete setup for your pulpotomy or your pulpectomy, whichever one you are going to do with your doctor. My next video will be step by step on how to complete the pulpotomy.